Hey there and welcome. Today we're diving into something pretty fascinating, the science of a purposeful life. It turns out this is a kind of hidden variable that has a huge, measurable impact on our physical health. So let's jump right in. So let's start with this, a really powerful observation. Researchers who are working with oncologists down in Brazil, they started noticing something. It was kind of incredible. They said they could often tell, right from that very first meeting, which breast cancer patients were going to be survivors. Now, this had nothing to do with the stage of their cancer or their treatment plan. It was something else entirely. Something going on inside their heads. So what was this missing ingredient? What was this powerful factor that seemed to be steering these life-or-death outcomes? Well, that's what we're going to dig into right now. This deep, deep connection between a person's mindset and their body's actual ability to heal itself. What the researchers saw were three really distinct patterns in how patients responded to their diagnosis. First, you had the survivor. These were the people who saw the diagnosis as a wake-up call, a reason to make huge life change, like finally quitting that job they hated. Then there was the non-survivor. This person felt like a victim, totally trapped by their life and their circumstances. And then there was a third group, the angry. They fought the disease with everything they had. But, and this is really interesting, they often ended up developing autoimmune problems down the road. And this is where it gets really wild. When they actually looked at the tumors under a microscope, it was like the patient's mindset was perfectly mirrored at the cellular level. For the patients who felt like victims, their immune cells were, they were just kind of hanging out around the tumor, not really doing anything. But for the survivor patients, their immune cells were right inside the tumor, actively fighting back, mounting the exact response you'd want to see. Their mental state was literally being reflected in their biology. Okay, so if our mindset can be that powerful, it kind of begs the question, doesn't it? What about happiness? Believe it or not, science can now start to measure even abstract ideas like this, and it all starts with understanding that not all happiness is the same, which brings us to our next big idea, the difference between pleasure and purpose. So researchers basically split happiness into two main types. On one side, you have what's called eudaimonic happiness. The easiest way to think about this is deep fulfillment. It's the kind of satisfaction you get from having a real sense of meaning and purpose, from growing as a person. It's about your life as a whole. And then on the other side, you've got hedonistic happiness. This is all about pleasure and enjoyment. The happy moments like a great meal or going on vacation. It feels good, but it's temporary. So you might be thinking, okay, two kinds of happiness, who cares? Well, it turns out your body cares a lot. This is the crucial part. Studies are showing that a life that's really rich in that pleasure-based hedonic happiness is actually linked to higher gene expression for inflammation. But a life built on that eudaimonic, purpose-driven happiness, that's linked to lower inflammation and a stronger immune response, better antibody and antiviral defenses. The kind of happy you are directly talks to your immune system. So why doesn't that pleasure-based happiness give us lasting benefits? Well, it's mostly because of this thing called the hedonic treadmill. You know the feeling, right? We want something, we work for it, we get it, we enjoy it for a little bit, and then we just kind of adapt. The new car becomes just the car. The shine wears off, and we're right back where we started, looking for the next thing to make us happy. Now, for ideas about life purpose to be taken seriously, scientists need a really solid way to study them. How do you even begin to research something so big and philosophical? Well, they use a structured framework that helps turn these huge questions into something clear and testable. It's called the PICO framework, and it's actually pretty simple. P is for participants. Who are you looking at? I is for the intervention. What's the thing you're testing? C is for comparison. Who are you comparing them to? What's your control group? And O is for the outcome. What result are you trying to measure? So for example, you could take participants with low purpose, give them a meaning-focused intervention, compare them to a group that didn't get it, and measure the outcome on their inflammation levels. See? It's just a logical roadmap for finding answers. Okay, so let's zoom all the way out. If a sense of purpose is this critical to our actual biology, what does that mean for how we think about health? What does it mean for our entire healthcare system? This stuff has some really profound implications for the future. Let's just be real about the core problem we're facing. Our current healthcare model is basically a business that, by its very nature, incentivizes sickness. Think about it. Hospitals, drug companies, even doctors' offices. They all make more money when people are unwell. The more sick people there are, the more the system profits. But what if we just flipped that entire script? This is a vision for a totally new model, inspired by a researcher named Tracy Goddett. Instead of being reactive, we'd be proactive. Instead of just managing disease, we'd be optimizing health. We'd shift from being problem-based to being aspiration-based. And maybe most importantly, we'd move from being laser-focused on the disease to being focused on the whole person and their unique sense of purpose. And this quote from Tracy it really nails the heart of this new vision. Imagine if the whole point of healthcare wasn't just to fix what's broken, but to help people figure out what they want their health for in the first place, and then support them in living their most meaningful life possible. That changes everything. So we're going to end by turning this right back to you. After seeing just how deeply our sense of meaning is woven into our physical well-being, maybe the most important health question we can ask isn't about diet or exercise. Maybe it's this: what is your life purpose? It's a question worth sitting with, because the answer might just be one of the most powerful forms of medicine there is. Thanks for joining me.